Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. You know, in Canada there are 2 million diabetics, and there's another 7 million people who are on the cusp of diabetes. They have pre-diabetes. That's almost 1/3 of the population who are diabetics or pre-diabetics. Now, in pre-diabetes, that means that your fasting blood glucose or your fasting blood sugar level is between 5.7 and 6.9 millimoles per liter. And usually these individuals have other risk factors that increase the development of diabetes. So they often will have a waist circumference, if it's a man, over 36 inches. For a woman, a waist circumference over 33 inches. And other factors like high triglyceride levels, high blood pressure, low levels of the good cholesterol, the HDL. Usually these things merge together into a profile that gives you a pre-diabetic state. Now in the United States, 100 million people have either diabetes or pre-diabetes. So that's almost 1/3 of their population. 9.4% of the population already has diabetes. So this study published in November of 2017 in the Journal of the American Medical Association, Internal Medicine, looked at 43 international studies of people with pre-diabetes. What they wanted to see was, what is the best treatment or intervention to prevent people from going from pre-diabetes into full-blown diabetes? Now, in these 43 studies, what it showed was that the patients who made lifestyle changes around dietary modifications, being more physically active, really had the best results compared to any other intervention that was tried, including standard medications. What they saw was that just losing a few extra pounds was the most important factor in reducing risk. For every kilogram of excess body fat a person lost, that's every 2.2 pounds they lost, there was an additional 7% decrease in risk of progression to diabetes. So in the 19 trials where diet and lifestyle modifications were the treatment, and they saw these patients over, on average, for about 2.6 years, overall those patients using dietary changes and exercise had a 39% lower risk of being diagnosed with diabetes compared to controls. So the controls are the patients who weren't really given any treatment. When the patients who combined improved diet with exercise or physical activity saw the best results, a 41% reduction in risk of going from pre-diabetes to diabetes. Now in the trials where they just used medications, during a treatment period of 3.1 years where they were treating people with medications for diabetes, the patients on medication had a 36% lower risk of being diagnosed with diabetes compared to patients who weren't given any treatment. But then they looked at what's called the washout period, where there was no ongoing office visits for any kind of treatment. So after a washout period with no formal lifestyle treatment, after a mean follow-up of 7.2 years, the patients that originally had been introduced to lifestyle modification still showed a 28% lower risk of being diagnosed with diabetes compared to the control subjects. So even though they weren't having to show up and explain what their diet was and demonstrate what exercise they were doing, somehow a lot of these people continued to do the routine, and it helped prevent diabetes. 7 years later, they're still showing a major reduction. The drug trial patients, after a washout period of no drug treatment, after just a mean follow-up of 17 weeks, these patients didn't show any greater reduction in risk of diabetes compared to the control subjects. The bottom line is not that medications aren't good to help treat diabetes or help prevent it, because there are some good medications. But the bottom line is that there's a lot of people walking around with just that little extra bit of body fat and a blood sugar level that's creeping up towards the diabetic range, a little closer every year. And you know, with diabetes comes a shorter lifespan, with increased risk of needing an amputation, going blind, the need for dialysis treatment 3 days a week, increased risk of heart attack, peripheral neuropathy, where you get pins and needles, you don't have any sensation on your feet, you get foot pain, you have open wounds on your foot. You know, it really isn't worth it. You know, remember the simple math. If you simply eat 100 calories less per day, which is nothing, and you burn an extra 100 calories per day via just doing a brisk walk for 10 to 12 minutes, in 1 year you will have lost 24 pounds of extra body fat. And this applies to everyone, no matter what your metabolism is. And most people don't need to lose 24 pounds. 10 to 15 pounds would already make a significant difference here. So if you're on the cusp of diabetes, and many people are, some simple nutritional modifications and a bit more physical exercise or activity can reverse all the major risk factors. They can start trending your blood sugar down, your waist circumference comes down, your triglycerides come down, and as you lose body fat and you exercise more often, your blood pressure comes down. And with exercise and decreased body fat, the liver starts to make more of the good cholesterol, the HDL, which takes the cholesterol out of the wall of the artery and brings it back to the liver, opening up the blood vessel again so the blood can flow. So these studies confirm that you have the power to prevent this leading killer and its undesirable quality of life-changing complications. You don't need to develop diabetes unnecessarily. So I've included the scientific reference below. Thanks for watching, and I'll see you next time.